Never compromise your values. Now let's head out on location. We're here in the new Generations Tower at ProMedica Toledo Hospital with both its president and chief nursing officer to get an inside look at what this new innovative tower provides to patients. Dawn, it's so great to be here at the new Generations Tower with you.
Hi, thank you for coming and joining us today.
So give us some details on the tower. Tell us a little bit more about the number of beds and the size of the building.
Excellent. So we have over 300 beds that we opened in this new tower, fully occupied. It's a replacement facility for our original building that was built in the 1930s. You know, as technology has advanced and the needs for our patients have advanced, we really felt that we needed to put together a better plan for a healing environment that really meets the needs of the patients today.
So tell us a little bit more about those beds and what those are going to be used for.
So we designed each of the floors so they are exactly the same. So each floor is set up so that there are beds that treat our lowest acuity to the intermediate and then progress up to the ICU. We've included 30 additional ICU beds in the tower, anticipating that the sickest of the sickest will be here over time. And then the patients and families actually can go to the same floor, which is really nice.
So Dawn, tell us a little bit more about the new technologies, smart technology, engineering, and ergonomics that are here in the new Generations Tower.
So as we planned the building, we really wanted to minimize the amount of steps that our nurses took on a daily basis, and so we were able to decrease the number of miles that they walk every day. We have a nurse server that you'll see when you go upstairs that is really there to make sure that the medications and any supplies that are in the room are at the fingertips of the nurse, as well as we have some mobile-enabled technology that allows the alarms and any patient communication to go directly to the nurse.
Now talk to us about Generations Tower and how that's really impacting patients' well-being and their experiences.
So when you go upstairs, you're going to see a lot of natural light. We have floor-to-ceiling windows. It's warm. It's just really there to make sure that the healing process is enhanced. We can accommodate families and extended families, which we were not able to do in the past. We have private rooms, all private rooms, which we didn't have in the past either. So it really was designed in collaboration with the staff to optimize nature and the view and the healing process. We had great collaborative partners in the community and our staff. Our best resources are the people that are there, boots on the ground every day, and so we use them as a resource from picking out the furniture to designing the head wall behind the patient bed.
So let's go upstairs and take a look at some of the patient rooms.
Excellent.
Deana Sievert, you are the Chief Nursing Officer for ProMedica, and it's great to be with you today up in one of the patient rooms. Tell us a little bit more about some of the new technologies here.
A couple of the things that we've done that's been very interesting is that we've focused really on trying to make the caregiver workload a little bit lighter so that they can spend more time with our patients. And so what we've done is we've created our nurse servers, and our nurse servers allow the nurses to have everything right there where they need it so that they can spend more time and attention with the patient and the family on the important things.
So describe the nurse server for us. That is not a person serving us. That is an actual piece of equipment and technology that's in the wall. Is that correct?
That's correct. They can access them from the outside of the hallway. So when our caregivers need to restock those nurse servers, they can access it from outside in the hallway, so they don't actually have to come in and disturb the patient. For the nurses, though, they access it from the inside of the room so that they don't have to leave the room. They can actually stay with the patient, get what they need to take care of the patient, and then spend more time with that patient.
So tell us more about some of the enhancements in the obstetrics unit.
Historically, our moms would send the babies to the nursery, and that would create an environment where maybe they weren't able to bond as well as we wanted them to with the baby. So we've created a room-in model where the baby will actually stay in the room with the mom. What we're really trying to do is create that environment where mom has easy access to the baby at the bedside so that she and that baby can really form that bond, which is so important before they leave the hospital.
Now, perhaps it's a sign of the times, but now we have drug-dependent babies, and there is a special unit here for them, I am told. How is that working out here at the New Generations Tower?
Yeah, that's correct. So we call that our neonatal abstinence unit. It is specifically designed for drug-addicted babies. And so these babies require a lot of special environmental care, things such as keeping the lights down low or keeping a quieter environment for them so that they aren't so easily stimulated. And also, in addition to that, these babies they cry a lot, and the cry is kind of a high-pitched shrill cry, and so to kind of decrease the exposure for our babies who are not drug addicted, we've separated them into two separate areas, so we have that highly specialized care for those drug addicted babies in that nursery, and then we also have the other nursery for the babies that are not addicted to drugs.
Mm-hmm. Something that we're hearing more about in healthcare is this interdisciplinary care, where you're having sort of the doctor, the nurse, and various other disciplines be together in a particular common space. Tell us a little bit more about how that works here.
So our Generations Care, this is probably one of the most exciting things that we've done. We've created in the center of the unit collaboration hubs. This is where our physicians, our nurses, our therapists, our respiratory therapists, everybody can collaborate together to actually discuss the patient's care. And so we've really tried to create this environment where it's putting the patient at the center of the care and the center of the model so that everybody's surrounding that patient through the electronic health record.
Well, Deana, this has been really informational. Thanks so much for sharing this with us today.
Thank you.
Healthcare trends show that patients with less severe conditions will increasingly receive treatment in other settings. To that end, hospitals will continue to focus on the needs of patients who require highly specialized health care. For Business 360, I'm Christy Hoffman, on location. Now let's get some more inspiration.